Good evening. This is Straight Talk with Eugene Chan. Our guest tonight is Dr. Che-Chung, a medical health executive who has been with the hospital authority since 1990. During that time, Dr. Look managed various public hospitals, including the Queen Mary Hospital as chief executive, as well as various hospital clusters. His experience included the SARS period in 2003, and also more recently, COVID until his retirement in November 2021. Tonight, Dr. Look is going to tell us how we can cope with the high number of COVID-19 cases in Hong Kong. Welcome, CC.
Oh, hello, Eugene.
Thank you for coming tonight. We had the Secretary for Health, Professor Lo Chung Mau, here 2 weeks ago, and we were very optimistic then because the cases were only about 5,000 at that particular time. Now we have a more precise quarantine measure for the incoming person from overseas to Hong Kong. At the moment, we're close to 8,000. And I remember in March, we were up to 65,000. Do you think that figures, the alarming figure, do you think we'll reach that again on this upward trend at the moment?
Well, of course, we don't have a crystal ball for everything. The lesson learned during last time will guide Hong Kong, in my view, to avoid similar situation to recur again. And with the present vaccination, as well as social distancing measures, I think on one hand, we need to be prepared for a further upsurge in numbers, especially now during summer holiday and then with all sorts of people-to-people interaction. But on the other hand, I am confident that the Hong Kong healthcare system and Hong Kong in general, having learned the experience last time, can cope with the upcoming surge. But we need to work together.
Right. CC, I mean, it's very reassuring to hear from your view that we can cope, because during last time, definitely we have some very disturbing reports that we have overcrowded wards at the public hospitals. We're running out of oxygen. We even having problem maintaining the basic hygiene standards. I think many viewers cannot forget those pictures of our elderly patients waiting in the bed outside a hospital to be admitted, as well as some body bags on the ground, next to some life patients. So you said we have learned a lesson and you don't think that will happen again.
Well, what happened last time was disheartening and definitely not acceptable. And from what I know from, I've retired now, but, I have read from the news that the government as well as the hospital authority since then have worked out a basket of measures to anticipate another return of a COVID attack of that magnitude. And we had additional facilities. We have new measures in place, and we boost up the vaccination. And of course, we have antiviral and also a basket of measures to facilitate access of infected patients to antiviral drugs through teleconsultation, for example, through delivery of drugs to their homes, for example. And in terms of preparedness, I learned from the press conference that the facilities will be made available for possible upsurge and possible admission of patients, rather than last time. Last time it's reactive, and it's the other way around. And so with the revised and enhanced contingency plan in mind, in position, I think we should be able to cope with that.
Right, so you're saying that the gaps that we had with a sudden big increase in patients was kind of plugged in with what you've just said, telemedicine, and also with more facilities being allocated should something happen again.
Oh yes, as you know, everyone is monitoring, apart from the big number, how many patients a day. We focus on the severely ill as well as those who pass away. And the numbers, fortunately, remain static And so on one hand, we need to be cautious, but on the other hand, seems to me that the present measures are enough to cope with possible upsurge.
Right. Currently, as we've all read from the news, we have like 2,400 hospitalized COVID-19 patients right now. And I remember in March when the Hospital Authority Chairman, Mr. Henry Fan, was here, we had about 12,000 COVID patients and we had only 3,600 beds. So do we have enough beds now, just in case the numbers keeps going up and those patients needs to be hospitalized?
Well, I think if we ask whether it's enough, there are more than one angle to look at it. Right now, the home quarantine arrangement has been pretty effective, and we know many people who are infected and then successfully recovered using home quarantine. But then we need to define among the infected members of the public who should be in isolation centers, who should be at home, or who can be at home, and who needs to be hospitalized. So there are different levels of health needs as well as the risk. And then we match the facilities according to their risk. And for hospitals, it is important that we reserve the hospital capacity for those who really need hospitalization. For example, if they have heart disease, fracture, and so on, but they got COVID. But because of the other medical reasons, they need to be hospitalized. And of course, there are patients infected with COVID who may have, respiratory distress, like the children. And so they must be cared in the hospital.
Right, CC, last week, Professor Lu have called on for more active cooperation from the private sector to support the patient that they refer from the hospital authority. I believe the private sector have 5,000 beds, but they've only allocated 364 beds for this purpose. And even then, less than 50% was being used. That was widely publicized in the news. You being somebody from hospital authority, now you are in the private sector. So what are the stumbling blocks? Why isn't the private sector helping more from the viewer's point of view? And why are there so few cases already being transferred? Maybe you can shine some light on the matter.
Well, transfer a patient is never easy. In fact, it's a complex process. Even when I was working in a public hospital, even if we transfer a patient from a ward to another ward within the same hospital, it's going to be complex. We need to ensure the safety. We need to ensure that patients as well as the relatives, they do understand the rationale and so on. We don't wish the relatives to know the situation after we have transferred the patient to somewhere else. And how to ensure a smooth transfer process is extremely complicated. And this time we are talking about an unprecedented transfer of patients from public hospitals to various private hospitals. And in my view, the logistics and communications involved are extremely complex. And so what we should do is, in my view, assign on both sides maybe a senior nurse, let's say, to be the coordinator, and then to work out everything.
Right, but CC, you do agree that the private hospital should help to support the public?
Oh, certainly.
But why are there only 364 beds compared to the 5,000 beds they have in the private sector?
I don't know the discussion between the private hospitals and the government, but I would think I can sense a general intent of being willing to help from the private sector.
Right. So let's move on to another issue that's always also been in the news. Recently, there's a wedding cluster of hospital authority doctors that they went to a celebration, which I'm sure many of us hasn't been to many celebrations for years, but they happen to be infected. And the hospital authority was saying that they shouldn't be having parties. This is the message we got. Do you agree?
This is again a complex question. On one hand, as the healthcare providers, of course, we wish to maintain the healthcare workforce. We don't wish the doctors and nurses to get infected. And then on one hand, it's their health. On the other hand is other patients' health. On the other hand, they are also human beings. They have friends, they have relatives, and COVID is already 2 or 3 years. And sometimes it is understandable that they may have social gatherings.
So do you have any specific advice to your colleagues if they want to go to parties?
Well, I think whether this party or this gathering is really meaningful and important enough. Okay. And secondly, how to do a more precise risk management. Because in social gatherings, we take off masks. That is the most risky thing. Try to take off the mask less frequently. Right. And also when you go to any gathering, do an RAT, rapid test first. I mean, I do it all the time. If I have dinner appointment, I do the second time before I go to dinner. Nowadays, it's pretty simple.
All right, CC, let's take a break and we'll be right back. Welcome back. With us tonight is Dr. C.C. Lok, who was a senior medical executive with the hospital authority. We have been talking about whether our health system is prepared for the rising number of COVID cases. So C.C. in the first part is very reassuring to hear from you that you feel that the hospital authority now is more prepared just in case we have had an upsurge in cases, that all the medical supplies and personnel, even antiviral drugs is available. Now you're being in the private sector, and we know that there are also doctors in the private sectors who are willing to help with the public system. So has much been arranged, or is this channel readily open to your colleagues to help?
Well, I think the government has been trying to work with the doctors in the private sectors, both doctors as well as private institutions and hospitals, on how to take care of the whole thing. In particular, the vaccination, as well as treating the infected patients, as well as taking over the care of some non-COVID patients from the public hospitals. And I also see a lot of goodwill among the private sectors. I mean, I'm in various chat groups with the private doctors. And in fact, all of us are really keen to help. And so with this good foundation, we should, in my view, maybe make a little further steps ahead in order to help containing or tackling the pandemic at the community level. Right now, we know that we need to vaccinate more people, especially the elderly, as well as the babies, the children. And there are all sorts of anxiety and logistics difficulties for parents, for elderly persons to receive vaccination. And most of them live in estates, every district. And it's difficult for the government to centralize the whole thing. And so with the goodwill from the private doctors, we have private doctors, private clinic everywhere, every housing estate, every street. And if we can mobilize and work together closer, the doctors, the private doctors can help a lot.
CC, it's very encouraging to hear that you and your colleagues are willing to help, and I'm sure when the government hears that, I'm sure they will be very, very happy. Let's look at a new approach with the new government, with Professor Loh. He has mentioned that he's want to be more precise in terms of approach. And I was look at the reproductive rate of the virus now, it's 1.44, meaning that case numbers are likely to double in 2 weeks if the trend continues. And we have opinions from Dr. Ho Pak Leung, as well as Dr. Leung Pak Yin, saying that this situation should be contained under with the current vaccine policy, because we are worried whether they could go back to massive restriction or not allowing major events to hold like gatherings or even meetings. So do you think we are on the right track now with the policy, or are we still too conservative? Because if you look at Singapore, many places, they have no policy at the moment. Even in Singapore, as I just mentioned, they only wear masks in public transport or in hospitals or clinics. So what is your view?
Well, I think on one hand, we should make reference to what other places are doing. And we used to compare ourselves with places like Singapore. But if we compare, we need to learn from the good ones and the suitable ones. I mean, policies which are good in one place may not be suitable in another. And I would say the single most important thing right now is still to vaccinate more people. As long as we can protect people of Hong Kong, and then we can liberalize. This is what Singapore has been doing a bit better than Hong Kong. And it goes back to our earlier discussion, how to help those who are still having uncertainty and logistics difficulties in receiving vaccination to receive the vaccine as soon as possible. Even one dose is of protection. If everyone have 3 doses, then we have the ground and the ability to liberalize the social life.
CC, we'll come back to the vaccination in a few minutes, but another thing I'm sure the viewers they know that you're coming, they're going to ask me that different medical specialists do have different opinions, which is understandable, but in terms of COVID and how to deal with it, there are a lot of information, and most viewers find it very confusing, especially lay members. So how do you suggest that we move forward so that everybody will get the right message?
Well, it is in a way normal for experts and scientists to have a bit of disagreement with each other. This is by itself a bit not unhealthy. The issue right now is, as an audience, I mean, even I am a medical doctor. I mean, sometimes I may have difficulty to digest what different experts say publicly. The issue is in the news. We only hear a few sentences. We don't know the background data and analysis. And it is unfortunately not that feasible to have the whole talk in a news reporting, for example. And so what I suggest is for the audience, if we hear something which is contradictory or you don't understand, you try to ask someone reputable and you trust to explain the situation. For the official side of the government, it would be useful for the government to explain more the what and why, rather than focusing just on how and when. We need simple messages on how and when, but we also need another platform to explain to people. I mean, a lot of people are interested and intelligent enough to understand. And we have multiple communication channels right now by the government. And I would stress, this is not just communication, it is engagement. And this is the engagement which matters.
Right, CC, just earlier we talked about the vaccination rate. As you know, the elderly are the part of population, that 13% of our population is where they're most at risk. We found that 70% of the COVID hospitalizations are over 70, plus 90% of deaths are from COVID. So they're really a high-risk group. But if you look at the vaccination rate, for those who are over 60 years old, only 80% have one jab. So it's still far from perfection. Maybe elderly homes, they're better, doing 90% with 2 jabs. So how do you suggest the government, hopefully with the help of private doctors, how can we increase the vaccination rate for the elderly?
I think we must do it together and also move away from purely relying on big vaccination centers to point of care. And in fact, that is what Singapore has been doing. We try to engage the private sector doctors a lot, and they are everywhere, to go into near where the patients live, and then work with the local, maybe non-government organizations or community organizations, try to link up those elderly and other citizens to have a more direct and personalized advice from doctors. It's our experience.
So in a way, more proactive than
Yes.
motivate them for the passive to queue up and do the vaccination.
Oh, exactly.
Right. And then the matter I want to ask you is about, some said it's not fair that many of us, including myself and you, that we had 3 vaccinations. We still have to go through possible restrictions and social distancing because there's still many people who have 2 vaccinations. Unfortunately, they're still waiting for the 6-month grace period. Some people say that's not fair. Do you agree?
Well, it's hard to say whether it's fair or not. I mean, fair is a term not easily to be defined. But I would say we need to have an arrangement which can overall protect Hong Kong in the best manner, while does not restrict people in a unsustainable manner. And so for the scenario you mentioned, what we should do is try to see whether that so-called 6-month period should be we consider.
Right.
Because right now experts are saying, why not we lower the threshold for revaccination, which protects people.
There's been this term called hybrid immunity,
Oh, yes.
meaning people get immunity from infections themselves and also having vaccinations. What is your view on that? Which is better?
Well, we don't, I'm not a scientist, but in general, as doctors, we won't encourage patients to get a disease. And so if a patient gets that disease naturally or in an unavoidable manner, then that's the scenario.
Right. Many people who are infected will say, I'm not immune. Do you agree? I won't get a second time.
Oh, of course, the chance is not high, but definitely people get reinfection. We have big names elsewhere having the second infection. And as doctors, I won't encourage any individual to try to get another infection.
Right, so no relaxation in personal protection. That's what you're saying.
Oh, exactly. Personal protection, a must.
Thank you, Dr. Look. We appreciate your sharing with us your experience both with the hospital authority and in private practice. I hope our viewers will find your suggestions helpful and that this wave of cases will subside soon. Have a pleasant evening and good night.